Hello, welcome back to Pharma Training Solutions. Today I will be discussing drugs that are used in IBD, IBS, and spasmolytic drugs, meaning the inflammatory bowel disease, or irritable bowel syndrome, and all other disease conditions. Of course, briefly, not in details. Now, the IBD, or causes a disorder of chronic inflammation of the GI tract, characterized by ulcerative colitis and Crohn's disease. I'm sure you're aware of the the signs and symptoms of these diseases. Now, let me go straight to the agents which are used. We have the aminosalicylates. Now, which drugs containing 5 aminosalicylates, they differ from salicylic acid, but of course it is almost in the same. For them, they work topically within the GI. They are not absorbed. They work topically, hence they are effective in ulcerative colitis and causing Crohn's disease. And also, they can also inhibit PGD synthesis, or what we call the prostaglandin synthesis by COX, and interfere in the production of inflammatory modulators. Now, examples of these ones, we have the sulfur, salazine, olsalazine, balsalazide, and mesalamine. I'm sure you have these ones in the pharmacies. The side effects and all others, you can look for them. They contain 5 aminosalicylates and it differs from salicylic acid, and it works topically, not systemically. Also, glucocorticoids are used. They inhibit production of inflammatory cytokines. Of course, we know them. Prednisolone, they work topically. They used orally, and daily dosing. But we have to be aware of the side effects of prednisolone and prednisone. Hydrocortisone enemas are used. Those suppositories are also used to liver. They deliver the drug to the colonic for maximum effects. Let's go to IBS, the irritable bowel syndrome. Now, these are disturbances in the visceral, motor, or sensory function, and patients experience diarrhea and constipation at different times. It can be managed with both measures of diarrhea and constipation. However, sometimes we use spasmolytic agents or the antispasmodic, which are used. These are drugs used to treat the symptoms of abdominal pain and spasm with irritable bowel syndrome. The antimuscarinic drugs such as hyoscine can cause smooth muscle relaxation. Direct smooth relaxants, the meberavine or the dicloamine, and also sometimes have the skeletal muscle relaxant. Now, these ones are specifically for skeletal muscles. The baclofen and others, and the spasmolytic or the antispasmolytic. Let me briefly explain them. The meberavine has the effect on the colonic smooth activity, leading to relaxation. Dicloamine, dicyclamine, direct smooth relaxant with weak anticholinergic and effect, and of course it can also possess antiemetic effect. Adrotalvin, this is a non-anticholinergic smooth muscle relaxant, but it inhibits the phosphodiesterase 4 enzyme. It is used in IBS and abdominal pain. Adrotalvin. Ensure you are aware of the it's also called NOSPA, and this one, Adrotalvin. You are aware of the side effects and the dose and all the others. This is a short discussion. Let me briefly explain the spasmolytic drugs again, because we know that spasticity is a condition in which there is abnormal increase in the muscle tone of the GIT. Of course, abnormal function of the bowel or the bladder, as well as the skeletal muscle. Of course, I'm just repeating those ones above. We have the baclofen. These are the skeletal one. This is a GABA mimetic agent, and is an agonist at GABA receptor, resulting in hyperpolarization and hyperpolarization. Because when you have hyperpolarization, no action potential can take place. Hence, you can manage the stiffness or the pain, and also use the management of irritable hiccups. Other agents which are used, which have a spasmolytic activity, we have diazepam, gabapentin, and others. We also have drugs which can be used in treatment of local muscle spasms. They provide relief of acute spasm. Now we have this drug, chlorzoxazone, and metalone. Now in the pharmacy there is a combination of chlorzoxazone with paracetamol. I'm sure you're aware of this one. It is there. It is a good drug. Now remember, this has been a short presentation on spasmolytic agents. Ensure you refer to other presentation. Always remain Wilson from M-Pharma Training Solution. You can always contact us, or you can refer to official books. Thank you very much for listening to me. Subscribe to the channel in case you haven't subscribed. Leave a comment on how you can improve. Always remember, these are short presentations, and thank you very much.